by is that we should use the term adiposity-based chronic disease or ABCD as the new diagnostic term for obesity, because obesity is an imprecise term. It is defined on the basis of BMI cutoff, does not convey the health risk, and also is associated with lot of stigmatization. On the other side, ABCD, which is the new diagnostic term for obesity, explicitly defines obesity as a chronic disease. It also alludes to the precise pathophysiological basis and also avoids the stigma associated with obesity. Now, this is the basic cartoon where the whole understanding of obesity and cardiometabolic syndrome is there. So what happens is, in a person, let me choose the pointer. So, okay. So, in a person who is predisposed to get diabetes or obesity, there are multiple factors which interact. There is genetic factors, environmental factors, ethnicity, behavioral component, all interact to lead to a pre-diabetes state where there is increased accumulation of fat. Once there is increased accumulation of fat, there is abnormal distribution, there is abnormal functioning, and there is abnormal amount of fat. Now, because of the abnormal or excessive amount of fat, there are mechanical complications. Because of the abnormal function and abnormal distribution, there are metabolic or biochemical parameters which start changing. And ultimately, these lead to development of insulin resistance on one side, leading to further predisposing to pre-diabetes, diabetes, and macrovascular and microvascular complications. Those who do not develop diabetes to begin with get onto metabolic syndrome and are further predisposed to get cardiovascular disease, heart failure, atrial fibrillation, and so on. So, it is the abnormal accumulation of fat which leads to all this problem. So, let us see what is this link between this metabolic state and obesity. So, there are at least three distinct mechanisms which have been proposed to link obesity to insulin resistance and predisposition to diabetes. One is the increased production of adipocytokines, which include TNF-alpha, interleukin-6 and so on, which contribute to development of insulin resistance, and there are reduced levels of adiponectin. Second is the ectopic fat deposition, mainly in liver, central fat and pancreas, and also in muscle, which leads to this metabolic state. And last but not the least is the metabolic dysfunction, which is now shown to be there and is evident as decreased mitochondrial mass or mitochondrial function. Mitochondrial dysfunction could be possibly the most important underlying effect linking obesity not only to insulin resistance but also to the compromised beta cell function and development of diabetes. Now, we are looking at something called unified field theory, which says that possibly both obesity and type 2 diabetes share a common underlying defect, and this defect, which favors development of insulin resistance, also favors beta cell decompensation and development of diabetes. So what happens is, once we have obesity, there is increased amount of nutrients available to cell. So once there is excess of nutrients available to cell, these cells are exposed to the excess nutrients which are not required by them, and they get the damaging effect of those nutrient excess, leading to increased endoplasmic reticular stress, increase in the free radical production. There is mitochondrial dysfunction, there is production of or accumulation of triglycerides and the fatty acid intermediates, and finally activation of AKT pathway, which leads to development of diabetes. So in nutshell, in presence of primary disease risks, in presence of genes, genetic predisposition, environmental factors, so there is a complex interplay and there is development of obesity. Now once there is ABCD or adiposity-based chronic disease, there is insulin sensitive. It can be, to begin with, insulin sensitive or insulin resistant. People who still remain insulin sensitive go on to develop the biomechanical or psychological complications, but people who develop insulin resistance go on to develop the metabolic syndrome with pre-diabetes, pre-hypertension, dyslipidemia and so on. And further are at risk of developing hypertension, diabetes, coronary artery disease, CKD and so on. People who are insulin sensitive again go on to develop insulin resistance in due course and get all these components of metabolic syndrome. Once they get diabetes and hypertension, there is further increase in risk of cardiovascular events, heart failure and stroke, and ultimately all these conditions are coming as complication of this whole process. We know type 2 diabetes is characterized by two core defects, insulin resistance and beta cell dysfunction, and because the beta cell dysfunction is progressive during the course of disease, diabetes has been regarded as inevitably progressive disease requiring increasing